I want to talk about one of the biggest dangers associated with this type of storm.
I have to unfortunately announce that we have confirmed 2 deaths associated with this storm. 2 males who have unfortunately perished as a result of exertion, having cardiac events associated with snow shoveling and snow blowing.
It can be very, very dangerous for some individuals, people who have high blood pressure, people who have any type of cardiac history, to go out and shovel the snow, especially right now when the snow is so heavy because it's so wet.
Sounds like common sense to take it easy with the shoveling, but today's deaths are tragic reminders of the danger. And so joining us live right now to discuss is Natalie Asback, a local physician assistant who specializes in global health and emergency management. We really appreciate your time. And you know, obviously people want to get out there, they want to shovel so that they aren't trapped in. I mean, it makes sense. But what is your advice in terms of not pushing the limit and taking it too far?
Certainly you want to first kind of take a health history, right? If you have any kind of cardiac or lung disease, you need to be taking some extra caution first off. Anyone with previous cardiac events, whether that be a heart attack or stroke, anyone with arrhythmias or maybe high blood pressure or high cholesterol, those people really want to make sure that before they go out, that one, they're feeling well, and when they go out, they need to prepare like they're going out for exercise. And whether that be snow blowing or shoveling, both is strenuous exercise. It increases our need for oxygen, which then pumps up our blood pressure and also increases our heart rate. And when you take the cold air plus all of those things, it kind of increases your risk for any kind of cardiac event.
So Natalie, you talked there about some of the groups that are most at risk here. If you fall into that, you obviously want to be extra careful, but just for everyone watching, are there some early signs that you know while you're doing something like this that maybe something bad is happening?
Certainly, if you're out there and all of a sudden you're feeling dizzy, if you feel like your heart's racing more than it should be, some chest discomfort or chest pain, you need to go inside, you need to warm up, sit down, and make sure that those symptoms dissipate.
Natalie Asback is a physician assistant in Amherst Emergency Management. I know part of your specialty. Thanks so much for taking some time with us tonight to talk about this.